As we cross the threshold of after 80, our bodies begin to face greater challenges than ever before. Among these, a heart attack, also known as myocardial infarction, stands out as one of the leading threats to senior health. This isn't just a medical issue. It's a major concern for millions of families worldwide, particularly in the United States, where pioneering research has shed light on the mortality risk from heart attack in this age group. According to Dr. Robert Eckel, president of the American Heart Association, AHA, and professor at the University of Colorado, after 80, a heart attack isn't merely a health event, it's a critical determinant of survival, with a mortality rate higher than in any other age group. Data from the U.S. Centers for Disease Control and Prevention, CDC, reveals that cardiovascular disease, including heart attacks, is the leading cause of death among older adults in the U.S., accounting for over 30% of all deaths in those after 80. Today, we'll explore the reality of the mortality risk from heart attack for individuals after 80, what the specific percentages are, which warning signs to watch for, and how to protect senior health to promote healthy aging. Drawing on studies from the AHA CDC and insights from top experts like Dr. Eckel and Dr. Nanette Wenger from Emory University, you'll find detailed, practical, and actionable information to take steps right now. Let's embark on this journey to better understand the hearts of your loved ones. A heart attack occurs when a coronary artery becomes blocked, interrupting blood flow to the heart muscle. In younger people, the body often recovers more effectively, but after 80, the situation becomes far more serious. According to the AA's 2022 report, about 85% of heart attack deaths in the U.S. occur in people over 65, with a sharp spike among those after 80. Specifically, a 2021 study from the Journal of the American College of Cardiology, JACC, found that the mortality risk from heart attack in people over 80 ranges from 20 to 25%, within 30 days of the event 3 to 4 times higher than in those under. Why does the mortality risk from heart attack soar so high after 80? Dr. Nanette Wenger, a renowned cardiologist at Emory University, explains, as we age, arteries stiffen, plaque builds up more extensively, and the heart's resilience diminishes significantly. For someone over 80, a heart attack isn't just a shock, it's often the final straw for an already weakened system. CDC data from 2020 supports this, showing that over 40% of people after 80 have experienced at least one cardiovascular event, with heart attacks being a direct or indirect cause in nearly half of all deaths in this group. Another factor driving the mortality risk from heart attack is the presence of coexisting conditions. Research from the National Heart, Lung, and Blood Institute, NHLBI, indicates that about 70% of people after 80 with cardiovascular disease have at least one additional condition, such as hypertension, type 2 diabetes, or kidney failure. Dr. Eckel notes, diabetes, common among the elderly, doubles the mortality risk from heart attack by accelerating atherosclerosis. This highlights that senior health isn't just threatened by heart attacks alone, but by a dangerous combination of underlying conditions. Moreover, recovery after a heart attack is significantly harder after 80. A 2021 study from Circulation found that only 50% of people over 80 who survive a heart attack are discharged without needing long-term assistance, compared to 80% in those under 70. This underscores the importance of early detection and timely intervention to reduce the mortality risk from heart attack and support healthy aging. To fully grasp the mortality risk from heart attack in people after 80, we need to examine how aging affects the heart and body. As we grow older, the cardiovascular system undergoes natural yet challenging changes. Arteries lose elasticity, decades of plaque buildup narrow blood vessels, and the heart muscle weakens due to a reduction in active cells. Dr. Greg Fonarow, director of the Emerson UCLA Cardiomyopathy Center, explains, after 80, the heart no longer has the strength to compensate when an artery is blocked. This makes a heart attack more likely to lead to heart failure or death. Additionally, after 80, the body loses its ability to respond quickly to stress. A 2020 study from the American Journal of Cardiology found that in older adults, the sympathetic nervous system, which regulates heart rate and blood pressure during emergencies, functions less effectively. As a result, when a heart attack strikes, the body struggles to adjust and maintain blood flow, increasing the mortality risk from heart attack. External factors also play a significant role. According to the AHA, people after 80 are less likely to receive aggressive treatments like percutaneous coronary intervention, PCI, or coronary artery bypass grafting, CABG, compared to younger patients, due to concerns about surgical risks and overall health. Dr. Wenger observes, "We often see doctors hesitate to intervene aggressively in those over 80, but this can sometimes reduce their chances of survival." In fact, a 2021 NHLBI report shows that only 30% of people after 80 receive PCI after a heart attack, compared to 70% in the 60 to 70. Finally, delays in recognizing and treating a heart attack further heighten the mortality risk from heart attack. Many elderly individuals live alone or fail to identify symptoms in time, leading to late hospital admissions. This is critical because every minute that passes during a heart attack can determine the survival of senior health. Understanding the warning signs is thus the first step to protecting them and promoting healthy aging. Recognizing the early signs of a heart attack is vital to reducing the mortality risk from heart attack in people after 80. However, in this age group, symptoms are often atypical compared to younger individuals, making detection more challenging. Dr. Martha Gulati, Chief of Cardiology at the University of Arizona, warns, people over 80 rarely experience the intense chest pain described in textbooks. Instead, they may have vague signs that are easy to overlook. Here are the common warning signs in people after 80, based on AHA guidelines and U.S. expert research. Shortness of breath. This is the leading symptom in older adults, often appearing before chest pain. According to JICC 2021, over 60% of people after 80 with a heart attack report shortness of breath as the first sign. Unusual fatigue. A sudden unexplained exhaustion could indicate the heart muscle isn't getting enough oxygen. Dr. Gulati notes, many seniors think it's just age-related, but it could be a warning from the heart. Chest pain or discomfort, though not always severe, a heavy or tight feeling in the chest remains a key sign. In those after 80, it may spread to the shoulders, neck, or jaw. Nausea or dizziness, often mistaken for digestive issues or low blood pressure. These symptoms occur in nearly 40% of heart attack cases in the elderly, per the NHLBI. Cold sweats. This signals the body's response to cardiovascular stress, typically accompanying other symptoms. A major concern is that many people after 80 don't recognize these signs or delay seeking help. A 2020 circulation study found that, on average, those over 80 take over 6 hours to reach a hospital after symptoms begin, compared to 2 hours for those under 65. Dr. Fonero emphasizes, time is gold in a heart attack. Every minute of delay reduces the chance of preserving senior health and increases the mortality risk from heart attack. Thus, families and caregivers play a crucial role in identifying these signs. If you notice a loved one after 80 experiencing any of these symptoms, call emergency services immediately. Swift action not only saves lives but also sets the stage for healthy aging. Beyond age, several other factors elevate the mortality risk from heart attack in people after 80. Understanding these can help us develop more effective prevention strategies. 1. Underlying conditions. Hypertension, diabetes, and high cholesterol form a dangerous trio common in the elderly. The AHA reports that 80% of people after 80 with a heart attack have at least one of these conditions. Dr. Eckel explains, these diseases damage arteries over years, setting the stage for heart attacks and making recovery harder. 2. Sedentary lifestyle. A 2021 NHLBI study shows that people after 80 who are inactive face a 30% higher risk of heart attack compared to those who maintain light activity like walking. 3. Smoking and alcohol. Though less common in older age, a history of long-term smoking still poses a threat. A 2020 CDC report indicates that past smoking increases the mortality risk from heart attack by 50% in this group. 4. Kidney function decline. After 80, weaker kidneys add strain to the heart. According to the American Journal of Kidney Diseases 2022, chronic kidney disease doubles the risk of death after a heart attack. These factors don't act alone, they combine to create a perfect storm threatening senior health. The good news? Many can be managed through lifestyle changes and medical treatment, paving the way for healthy aging. How can we reduce the mortality risk from heart attack and safeguard senior health after 80? U.S. experts offer practical strategies based on research and clinical practice. 1. Risk factor control. Dr. Wenger recommends that people after 80 keep blood pressure below 130/80ths mmHg and monitor cholesterol regularly. Statins, if prescribed, can cut heart attack risk by 25% per the AHA. 2. Healthy diet. A low-salt, fiber-rich diet with omega-3 south from fish or nuts supports heart health. A 2021 New England Journal of Medicine study found that seniors eating at least 3 servings of vegetables daily lower cardiovascular event risk by 20%. 3. Light exercise. Walking 20 to 30 minutes a day, 5 days a week, improves circulation and reduces the mortality risk from heart attack, says Dr. Funnero. 4. Regular health monitoring. The CDC advises annual cardiovascular checkups after 80, including ECGs and blood tests to catch issues early. 5. Family education. Teaching loved ones to recognize heart attack signs and use emergency numbers is vital to saving senior health. These steps not only lower risk but also help people after 80 maintain a better quality of life, fostering healthy aging. Dr. Gulati affirms, age isn't a barrier to wellness. With proper care, heart attacks can be prevented or managed. If you or a loved one is after 80, don't let the mortality risk from heart attack silently loom. Start by visiting a doctor to assess cardiovascular health. Dr. Eckel says, prevention and early detection can completely change outcomes for the elderly. Build a senior health plan with diet, exercise, and regular checkups. For more information, consult the AHA or CDC. Every small step today is a giant leap toward healthy aging. The mortality risk from heart attack in people after 80 is a sobering reality, but it's not insurmountable. With support from AHA and CDC research and guidance from experts like Dr. Eckel, Wenger, and Gulati, we can safeguard senior health and transform the years after 80 into a time of vitality, happiness, and meaning. Act now to keep your or your loved one's heart beating strong.